What is your name and the name of your program?
My name is Margy Mayfield, and our program is basically the entire agency, which is Coastal Kids Home Care.
And what is your job title and what does that entail?
My job title is Director of the Program for the agency. And what does that entitle? It entitles, we are a licensed home health agency, so I run a home health agency, and so I'm involved in hiring and training all of the nurses that go out and see our families and patients. And then I also have a nonprofit side because we're a nonprofit, so I actually run that side too. So I have a development team that I work closely with to write grants and develop fundraisers.
Cool. And what organization are you guys a part of? You're saying that you guys are smaller.
We're actually by ourselves. We're a freestanding licensed home health agency in the state of California.
Okay, cool.
And the difference is we specialize in pediatrics.
Okay.
Yeah.
How long has your program been around?
We opened in June of 2005, so we're in our 12th year.
And how did it get started?
I worked for several home health agencies in my career, and basically the pediatric portion of the agency constantly kept being cut, smaller and smaller. And so I finally became extremely frustrated with my programs being cut. So people convinced me that we could open our own company and we could make it work. So me and a friend of mine who was a home health administrator started the company in 2005, applied for licensing, went through all the state inspections and things like that, and opened our doors, and we've been at it ever since. We are now the only home health agency that is strictly pediatrics in the entire state.
Wow.
So.
And who do you provide your resources to?
So our patients are referred to us from physicians, and we provide services to birth to 21-year-olds.
And how do you get referred by these doctors or qualify for the local resource?
So we provide skilled nursing, occupational therapy, physical therapy, and social work services. So if a physician assesses a patient needing some of those services, they give us an order that says, for instance, we want nursing to go out once a week to do dressing changes on this wound, or something like that. We are responsible for bringing children home from the hospital much earlier than if they didn't have home health. We also can prevent hospitalizations because we can provide medications or treatments that can be done in a home that don't have to be hospitalized. So home health agencies actually save a lot of money for local governments and things. But qualifying is a doctor writes an order and says they want us to do it, we can do it.
And what kind of services do you offer? So I know you mentioned physical therapy, things like that. What particular services does that entail?
So along with the physical therapy and the occupational therapy, so that would be for, with pediatrics, that's a lot of developmental things. So we work a lot with premature babies, babies who were born with like bad hearts and are a little weak. We also are therapists, like if we have cancer kids that have an amputation or something like that. So that's basically therapy for children. And then skilled nursing can be just a huge range of things. So it can be working with new premature babies that are coming home on oxygen and have really fragile lungs and things like that, all the way through. We have a huge cancer population that we take care of. We have kids with muscular dystrophy, cystic fibrosis, all of those things. And then basic things like, unfortunately, gunshot wounds and stabbings with gang members or something. So anything that can happen to a person while they were born, birth to 21. And then we have another really special program within our services, and it's palliative care for our kids that have life-threatening diagnoses. The local hospices in the 4 counties that we work in don't take children under the age of 21. And so we now provide those terminal care services for those kids. And we have an art therapist, a massage therapist, pet therapist, and music therapist that also work on a team with a bereavement counselor, social workers, and nurses to help that family through that difficult time.
Awesome. Is there any cost to your services?
Yeah, we take we bill insurance. And so Medicare is the only thing that we don't do. Sorry, that's the adult agency. So Medi-Cal, and then Blue Cross, Blue Shield, all that stuff. So we bill for our services through that. The cost to the family is usually the cost of a copay, like $10 or $15. But most of the time, it's actually 100% free. A lot of insurance plans nowadays have like 120 visits a year by a nurse or whatever. Medi-Cal has no copays for their families. About 70% of our kids are on Medi-Cal, and that's why we have to be a nonprofit, because Medi-Cal hasn't raised the rates it pays providers in 20 years.
Wow.
So we don't make near enough to cover the cost of doing our kids. So that's why we are a nonprofit, and we have to do all the fundraising.
And where do you get those funds from? Where does that come from?
Mostly it's just community foundations, and then we have we have 2 events that bring in money too. We do this annual event called Touch a Truck, and we turn the rodeo grounds into a giant playground with big, huge equipment and trucks and lots of fun activities. And that we do that every summer in September during childhood cancer awareness. It's one of our favorite things. And then on New Year's Day, we're the recipient of funds through a fundraiser at the Rio Resolution Run, and the Rio Grill sponsors that. But it's a race that we get the benefit from too. So otherwise, we have a really strong grant program that writes a lot of grants.
Cool. And then, how do you guys assess the success of your program?
Well, 2 ways of doing that. First of all, as nurses and therapists, as we go into a home, you immediately develop a care plan, and so you have goals, and you're always checking your goals. And in home health, we have to reevaluate our care plans every 60 days. So normally you're working towards those goals, and when you reach those goals, you discharge a patient. We also have to have pre-authorization with all of our insurances and Medi-Cal, and so they also are watching us to make sure that we aren't abusing the services and providing or going even when no services are needed. So there's that side of it that is kind of professionally built in and regulated. The other part of that is just we do a lot of outreach where we follow up with every one of our families, and we provide them with a survey just so they can give us feedback. And our physicians who refer to us, we give them surveys. So there's things that we do just to monitor ourselves internally to make sure we're doing a good job.
Awesome. And is there anything else you want to add, any information about your program that you want to include?
Just that this program is currently available in South Santa Clara County, San Benito County, Monterey County, and all of Santa Cruz County for kids.
Great. Well, thank you very much.